What is a normal dose of prednisone for somebody with GCA or giant cell arteritis? It's a question I get as Dr. Megan, your prednisone pharmacist. I'm here to help you not just survive prednisone side effects, but thrive while on prednisone. So if you have GCA, then let's talk about prednisone doses. So there's several phases of GCA, right? There's when you're first diagnosed, and then there's if you have a terrible relapse, and then there's steady long term. So let's first talk about when you're first diagnosed. So if you're very beginning, you're going to get a really pretty high dose, like I had to get for my condition of ITP. And that's somewhere between 40 and 60 milligrams of prednisone. And that is, the goal is to knock that inflammation on its head so that you can have your vessels with the proper amount of swelling and not being so swollen and leading you to have all the complications that you could possibly get with the GCA diagnosis. And so we need 40 to 60 milligrams, and that's quite a bit of prednisone. And the youre, which is the European League Against Rheumatoid Conditions, basically, they say that you want to continue that for at least several months. You start there and then you bring it down. So starting between 40 to 60 milligrams a day and then tapering. That means dropping the dose slowly over time until after about 3 months from your diagnosis, you're getting somewhere between 15 to 20 milligrams a day. And that is a normal medium to high dose right there that people are commonly taking for lots of conditions. Between 15 to 20 milligrams is a typical dose that people are taking for many conditions. And then the goal is, once you've gotten to 15 to 20 milligrams, to slowly, over a year, get you down to somewhere around 5 milligrams or less of prednisone. And that's the ideal situation. So essentially 40 to 60 milligrams, 2 to 3 months later, 15 to 20 milligrams within the year, 5 milligrams or less. And that would be ideal if that was keeping you under control and you didn't have any flares or relapses or other scary things happen to you. So if you happen to have a relapse, then they're going to increase you back up to 40 to 60 milligrams. And that's if it's a major relapse. If something major happens, you go back up. You're basically starting the whole clock over. If it's a minor relapse, and this is always in the judgment of your doctor, I am not your doctor, your doctor is the one in charge here, then they would take you to the last effective dose. So say you started out at 60, you'd gotten down to 20, and now you're at 15, and you're like, life is good, but you have a relapse. So you knew it worked back up at 20. So you would go back up to 20 and then start tapering from there over again. You wouldn't necessarily have to go back up to 60 or whatever, unless your doctor thinks it's a major relapse, and then it's worth it to you. What if you are having the worst outcome of the vasculitis, and that is potential blindness or vision loss? In that case, they would possibly, this is all the way out, always up to your doctor, hospitalize you and give you IV methylprednisolone, and they'd give you 1,000 milligrams, like a ton of prednisone equivalent. It is so much. It's like a nuclear bomb on your system to just completely zap all chance of inflammation happening. It's just like, it's the scorched earth policy at that point. We're doing everything we can to preserve your vision. That is the goal. And so when they do such a humongous dose like that, they're assuming that the benefits of keeping your vision are much greater than the risk of all of the many side effects you're likely to feel at that incredibly high dose. I have a friend who had that same high dose for vision loss for another condition, multiple sclerosis. And she said she was in the hospital, just like had laid out scrapbooking pages all the way around her hospital room. Like she had tables set up in there, and she was just going like steady, like for 24 hours a day because she couldn't sleep, and just made a whole scrapbook in like 3 days, like boom, 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 like this big, fat, thick scrapbook designed and beautiful because there's nothing else she could do. Just had to stay there in her room. So it can cause insomnia, crazy amounts of energy, like you can feel crazy. And so it's kind of good that you're being hospitalized. It can really mess with your blood sugars, tons of side effects at that kind of a high dose. So if that is you, then yes, this is possible. The benefits in that specific situation outweigh the risks. But what about taking it for that 15 to 20 milligrams? Do the benefits outweigh the risks? And there are a lot of complications of having GCA that you want to prevent. And so it's always, do you actually know whether the benefits outweigh the risks for you? And if you do, is there anything you can do to help tilt the benefits scale into your favor? And that is why I created the Prednisone checklist. It has the top 7 mistakes people make when taking prednisone, 15 things you can actually do about it, 25 of the top side effects people have, and what you can do about each of those, so that you know all of the possible things that you can do to prevent as many side effects as possible. If you'd like a copy, just click the link below and you can get your very own prednisone checklist that will help you cope with the side effects so that if you have to take prednisone long-term, it's worth it for you. Signing off as Dr. Megan, your prednisone pharmacist.